Hello and welcome to Reportage. I am Danish bin Nabi. My today's topic is about the rising suicide cases in Kashmir Valley. To discuss about this topic, I have with me a consultant psychiatrist, Dr. Junaid Nabi. Dr. Junaid, let me begin by quoting a media report to you. As per one of the reports, the SMHS hospital saw 168 cases in the suicide cases in the month of April, and in the month of May this year that rose to 120. Why do we see a surge in suicide cases in Kashmir Valley?
See, if we take into consideration the current scenario, there has been pandemic which has been there from last 1.5 years. तो उसकी वजह से क्या हो गया है कि ये complete lockdown हो गया. और if we take into consideration, there are a number of reasons. One of the main reasons is financial issues बहुत हो रहे हैं. बहुत private sectors में जो भी job कर रहे थे, they have lost their jobs. और बहुतों का there has been cut in the salary. वो चीज़ है. अगर हम बात करें जो भी ये ट्रेंड चल रहा है दिस पेंडेमिक, देयर वाज कंप्लीट लॉकडाउन. और जो भी फ्रॉम लोअर सोशो इकोनॉमिक क्लास के जैसे वेंडर्स है या तो इसका पे वना अथ मजूर, जो उनका क्या है कि दे वट एवर दे वुड अर्न ड्यूरिंग डे, वही पैसा वो शाम को उसी चीज़ खरीदते थे और उसकी वजह से उनका घर चलता था. वो प्रॉब्लम्स हो गई. तीसरा है जो भी एक इंसान इस पिछले 1-1.5 साल से घर पे रहा. यूजुअली क्या होता था कि जो मियाँ बीवी यूजुअली वर्किंग क्लास होते, तो दे वुड गो आउट, दे वुड वर्क एंड एट इवनिंग दे वुड मीट, हैव डिनर एंड स्लीप. अभी क्या हो गया कि 24 घंटे वो इकट्ठे रहने लगे और जो भी लैकिनीज होती हैं वो रिलेशनशिप में वो सरफेस पे आ गई. देयर इज़ एन एग्जांपल, अ फ्रेंड ऑफ माइन टोल्ड मी दैट दे हैड अ लव मैरिज. तो उनको लग रहा था कि उनको सब कुछ ठीक चल रहा है, नथिंग इज, नो प्रॉब्लम इज देयर इन देयर रिलेशनशिप. मगर जब वो इकट्ठे रहने लगे, मानो इकट्ठे रहने का क्या है कि
ड्यूरिंग दिस पीरियड ऑफ
पेंडेमिक, तो उसकी वजह से क्या हो गया कि वो डिस्कॉर्ड बढ़ने लगा. छोटी छोटी चीज़ों पे देयर वाज अ डिस्कॉर्ड. तो उसकी वजह से फिर वो रिलेशनशिप थोड़ा स्ट्रेन हो गई. देन दे रियलाइज दैट दे हैव टू वर्क ऑन देयर रिलेशनशिप्स. होता है ना कि जब एक इंसान किसी सिचुएशन में होता है, देन वी रियलाइज हाउ गुड ए पर्सन इज़, रादर देन एक इंसान को वो हाइपोथेटिकली बोला कि सब कुछ ठीक चल रहा है. वो चीज़ है. तो सेकंड मैं बोलूँगा कि टेम्परामेंट, जो भी कल का जो रिलेशनशिप इश्यूज़, जो भी जनरेशन है करंटली कश्मीर ना हर जगह, बहुत मैं मानता हूँ उनका टेम्परामेंट, जो टॉलरेंस लेवल बहुत कम हो गया है. मॉडर्नाइजेशन बहुत ज़्यादा हो रहा है. डिमांडिंग लाइफ बहुत ज़्यादा हो गई है. मटेरियलिस्टिक बहुत ज़्यादा हो गई. तो ये जो डिमांडिंग लाइफ है उसकी वजह से भी इश्यूज़ होने लगे हैं. थर्ड विल बी जो सब्सटेंस अब्यूज़ है. मानो बहुत सारे केसेस आ रहे हैं. इट्स लाइक इफ़ आई टेल दैट इट्स जस्ट लाइक एन पेंडेमिक, आई थिंक आई वोंट बी रॉन्ग इन देयर, क्योंकि एन नंबर ऑफ केसेस हैं जो बढ़ रहे हैं. तो उसकी वजह से भी जो सुसाइडल टेंडेंसीज है, केसेस है, बढ़ रहे हैं.
Among many of these causes, forced marriage has been one of the important causes as far as suicides are concerned. How do you explain this to us?
See, forced marriage, we can't explain that now. It would have been from the beginning itself. But the thing is now, because of the social media and all, जो भी media भी coverage दे रहा है, उसकी वजह से these things are coming in limelight now. Yeah, that is one of.
Otherwise, forced marriage were already existing there.
Definitely, they would have been there. I can't take it as a trend now. जो भी है कि अभी forced marriage हो रही है, it would have been definitely from before as well. जैसे childhood marriage है, पहले नहीं था उसके ज़्यादा कुछ, मगर जो अभी कल का है, अभी we just talk about that more. तो forced marriage का भी reason है, whether that is dowry, whether there is जैसे कल ही मेरे पास एक patient आया, he just 20 years when he married and now he is 33. Now he is saying that I believe that I was not that old to get married. मैं उतना mature नहीं था और that's why जो उनकी जो भी relationship है अपनी मिसिस के साथ, that is not going that smooth. तो वो भी एक इम्पॉर्टेंट इशू है कि किस एज पे एक इंसान को शादी करनी चाहिए. ज़्यादा लेट भी नहीं करनी है, मगर एटलीस्ट ए पर्सन शुड बी मैच्योर एनफ टू हैंडल सिचुएशंस.
सो आप ये कहना चाहते हैं कि forced marriage like dowry and other things were already existing in the Kashmiri society. It's only because of the social media that it's coming to the fore.
Yes,
now.
I believe this would have been definitely there, but because of social media
and other media platforms,
now this
now it's come
yes,
to the limelight.
Yes, right.
Experts have also warned us about the copycat phenomenon
Right.
as far as the suicide cases are
Right,
concerned. Explain to me what this copycat phenomenon is.
See, the copycat phenomenon is अगर एक ने किया तो मैं भी वही करूँगा. That depict करना है वैसे. जैसे if we take an example of actor, so famous actor who committed suicide, Sushant Singh Rajput. उसके बाद से I believe that trend risen like anything for some time, because what we feel when we just look at these superstars, we believe their life is the best possible, but it is only when you come nearer to them then you realize even they are having some issues related to their life. What we came to know that he was under depression, he was having depression and he was undergoing treatment, और वो घर वालों से भी दूर था. So that is one of the reasons for that. And what I will be telling you here, that when we select a model, a role model, we should not focus on that how much achievement he has done. We should be focusing on what he has done and whether we will be able to depict him properly.
Is this copycat phenomenon existing in Kashmir right now?
Yeah, right. I believe the way these children, I believe they are all very young. They are doing that absolutely copycat. If one has done, another
And
is...
before they make this video for the suicide, then they do the suicide.
Right. See, I will here tell you two things. That one will be, there are two types of suicides. One is planned suicide, second is impulsive suicide. Planned suicide is when a person knows and he has decided when, where and how to do a suicide. And there are in those suicide, complete suicide is more oftenly seen as compared to a person who has done it impulsively. Like किसी को marks अच्छे नहीं आए, he or she got scolded by his parents, और कोई चीज़ मांगी एक बच्चे ने, parents ने नहीं माना, and that happened, or someone have gone through breakup, relationship issues, तो वो भी कर लेते हैं. तो but those are all very impulsive in nature, so that complete suicide are very less in that.
If we talk of Srinagar district, we see the majority of the suicides took place in the Nurbagh area of Srinagar. Explain to me this. How would it affect the people of that area?
Yeah, definitely that would, because if a person is doing it, it will have a negative effect on the society as well. अगर कोई अच्छा achieve करता है तो उसके positive effect पड़ता है, अगर कोई गलत चीज़ करता है तो गलत करता है. Here I will tell you that we can never justify committing suicide, because this is how life is. There is nothing is temporary in this. No, sorry, nothing is permanent in this life. Everything is temporary. There is a good day, there will be a bad day. This is how life it is. So we should not be so impulsive to take our life. And I will tell you one thing, maybe it is a bit harsh, that the people who are committing suicide and trying to do it, they act very selfish. They never think about their parents, about their well-wishers, siblings or friends. What impact that will have on them once they will complete a suicide. So we have to take that into consideration.
We have also seen another thing between the two, the suicide and the suicide survivors. There is the coverage for the suicide people, and those who survive, there is absolutely no coverage in the media.
So this is what I have been telling it in the beginning as well, when I was talking about last year, when I was talking about this COVID, that we always talk about how many patients are coming positive rather than how many are getting well. So this is the problem. Don't take it otherwise, but this is the problem
with the media
people. That they will never talk about the positive things. They will always talk about the negative things. So that will just add on to the fear in the people.
So you are suggesting that sometimes media people need to be positive.
Right.
And show the positive side of the coin.
Obviously, yes. Because if we take into consideration this pandemic, the way this thing was covered, there was so much more stigmatization. You might have heard that a female...
But is media responsible for that stigmatization?
No. I'm not talking about media as a whole. I'm saying the way it was covered. If we take into consideration that female, the Khaniar wali, जो पहली female हुई थी, उसको वैसे प्रमोट किया था कि प्रोजेक्ट किया था कि जैसे उसने कोई गलती की थी.
Was media responsible for that?
No, I'm not talking about the media per se, the people itself, but the way this pandemic was flared up, उतना negative impact बोला था कि अगर किसी को भी टच करोगे तो ऐसा हो जाएगा. तो people have started.
But media never said that कि किसी को भी टच करोगे और pandemic हो जाएगा.
नहीं.
I have not come across any such report.
नहीं. What I mean to say that जैसे आपने बोला ना positive negative की बात, तो अगर हम पॉजिटिव की बात करते हैं कि इतने ज़्यादा केसेस ठीक हो रहे हैं, तो वो ज़्यादा ठीक रहता है एज़ कम्पेयर टू कि कितने ज़्यादा नेगेटिव मानो कितने ज़्यादा पॉजिटिव आ रहे हैं, तो वो ज़्यादा ठीक रहता।
Dr. Junaid, do we have a proper rehabilitation process for these suicide survivors?
We have put up a helpline जो हमारे पहले भी थी, जब कोविड भी स्टार्ट किया था, अभी भी
But
हमारे
isn't
पास
there a proper mechanism for their rehabilitation? Do we have any infrastructure, anything regarding it?
currently I don't think so. जो भी है यूजुअली जो भी अगर हम मेंटल हेल्थ रिलेटेड इश्यूज़ की बात करें, जो भी जैसे हम डिप्रेशन में हमने देखा है ज़्यादा होता है, स्किज़ोफ्रेनिया के बारे में बहुत होता है, तो वी डू टेक केयर ऑफ देम. But
Kashmir has absolutely no infrastructure, no proper mechanism in place as far as suicide survivors are concerned, right?
I believe I am not aware about it. I can't talk about it. I have no idea about that.
Absolutely nothing.
Okay, maybe.
Is it yes or a no? Maybe is it yes? Maybe
I'm not aware. I'm not aware about it.
You don't want to answer the question.
No, actually, I don't know about it, so I can't say whether it is yes or no.
Mr. Junaid, my last question. Is suicide the way out?
Not at all. It can't be justified in any way. Suicide, it's a precious life. A person is losing a life, and he will never get a chance to come back in this world. And this world is how it is. There will be good days, there will be bad days.
And you have to take it.
Sorry?
You have to take these days.
Yeah, you
whether
have to,
bad or good.
Right. And we have to take these. That is the meaning of life. If we have only good days or if we have only bad days, so how we can judge what will happen if we had a bad day or a good day? So that thing has to be taken into consideration. And as I already told you, that a person who is committing suicide, he is acting very selfish. He never thinks about his family members what will happen to them.
Dr. Junaid, a person who commits suicide is acting very selfish, right?
Yeah, right.
Dr. Junaid, thank you for talking to me.
Thank you so much.
Thank you. Please subscribe to our channel Reportage and press the bell icon to remain updated.